Hello everybody. Let us talk about introduction to health informatics in today's video. So what is it all about it? It tells us exactly about how informatics, how it will help humanities to put a stop to the spread of, let's say, the great pandemic that raged across the world. In fact, if we can circulate or if we can isolate those viruses and bacteria within the shared knowledges that everybody is generating, if that can be shared around it, and that is what health informatics is all about. It Yes, we will be talking about health informatics in this video under the fact that global evaluation monitoring network for health is concerned, or this is GEMNet. Remember, global evaluation and monitoring network for health, and that is what we will talk about it every time I speak about GEMNet. It is global evaluation of monitoring and network in health to foster organizational growth, collaborations, mutual support, to monitor and evaluation. Definitely, that is what we are looking into it of health program globally across institutions through linkages among members. Now, what are we looking into it? It is the fostering of growth, collaboration, mutual support. That is through monitoring and evaluation, right? Now, how do we do it? We do it by joint training as an impact evaluation. So, there is a pandemic or there is a spread of a disease in one corner of the globe. Let's say the example of Ebola. The spread of Ebola, can we curtail the spread of Ebola? Yes, definitely. If the community can be isolated, definitely it can be quarantined and probably will spread. Check the spread about it. Now, what have we learned from that community? What was this learning takeaways? Can we similarly replicate that practices in different corners of the world to stop the spread of Ebola or certain pandemic thereby? So that is what joint trading would be looking into it. Links with external stakeholders, and I am talking about GEMNet exclusively, the health activities global evaluation and monitoring network for health. Coordination and cooperation, as in formal and curriculum harmonization. That is all about competency development, mapping of existing curricula. Yes, health informatics course, what we are looking into it, growing interest for health informatics in the LMC, LMIC, low and middle income countries. Remember, low and medical income countries will have a vibrant population, young population. At the same time, the economy is not developed. So the health network is absolutely weak, or should I say it's very brittle in nature. So reduce the inefficiencies. We are talking about improving access, reducing cost, increasing quality. Need for skilled workforce. Technology spread is much faster than the skills. Sustainability of digital health is in doubt. So how do we go around? There are four steps. First is all about capacity building interventions in health information system through stronger actions for health system. Now, what does once the capacity building happens, the intervention can take place, and that is where we will try to full bring a stop to the spread of pandemic, any epidemic thereby. So improving outbreak detection through strengthening health information system. This can be done or replicated into easing of data collection, as in what is your community learning, what is the takeaways, burden and healthcare provided by strengthening HIS or healthcare information system. And this will relate to an establishment of the best practices as in improving the continuity of care by strengthening it. Remember, strong health information system means improved health system, which in turn means a better outcome for the general population. Now, this is what have been done in 2008, approximately 6-7 years back, 5-6 years back. It was we spoke about digital health, and this resolution was proposed by Algeria, Australia, Brazil, Estonia, Ethiopia, Germany, India, Indonesia, Israel, Italy, Luxembourg, Mauritius, Morocco, Panama, Philippines, and South Africa. We spoke about digital health way back, approximately 6-7 years back. What is it all about? It has a role in advancing SDGs, Sustainable Development Goals, complement, integrate, and people-centered health services, help contribute to the improved population's health and health equity, including the gender equality per se. Yes, how do we go about the digital technology? It is usage of the digital technology in health delivery. Probably your online medicine shop, probably any online consultation with the doctors, probably any teleconsultation with the doctors. And I am just talking about the elementary things. I am not even talking about robotic informations or robotic surgery per se. So prioritizing development, evaluation, implementation, scale up, and greater use of digital technology. Work towards and support the interoperability of digital technologies using international and open standards. Build capacity for human resources for digital wealth. Build public trust and support for digital health solution and application. We will talk about the terms. Now, what are we talking about is HIS or the Health Care Information System. There are two ways to collect those or collate those information. One is from the population-based data, as in number of population, census, the registration into the portal, and the population-based survey thereby. Now, another thing is something which is health institution based service, as in administrative records, as in service record, as an individual record system. Can these two population collected from different sources, can they be matched? Can they be married? And probably that will enable us to understand what is health informatics. Remember, defining information management, information system, technology, and informatics explain the basic theoretical concept that underlies information practices. Define the meaning of health informatics as a field of study, as and practice. Describe health information areas of application. Summarize informatics drivers and trends thereby. Now, remember what is it? There is something called data. It's random inputs and output inputs that comes around it. Random data be generated every now and then. And if we can make those sense of our data, it becomes information. So please understand, with data we generate, we collect, we organize, we validate, we analyze, we store, we integrate. But with information is we disseminate them, we communicate them, we present them, we utilize them, we transmit them, and obviously we safeguard them. But in general, what have been done, data and information both are interchangeably used. It's all about information system and information technology. Automated system is computer hardware and software, receives, stores data, processes data, and output data per se. Remember, the science of information is all information is equal to data with a meaning, if I may say so. So definition based on data, data, informations, and knowledge. Data, information, and knowledge. With these two, what we are looking into it, as the case might be. Information is the science of informatics is the science of information, where information is just the data with meaning, and was stated way back in 2009. Now, what are we looking into? With data is anything. It can be a symbol, it can be a fact, it can be a measure, as long as it is being represented in numericals. Information, data processed to be useful, provides the who's, the what's, the where, the when. Knowledge is application of data and information, provides the how. Wisdom is the evaluated understanding, provides the why, as on when on basis. Now, what are we looking into it? The medical informatics is the clinical informatics. There's the biomedical informatics. Look at it. See the number of verticals that comes around with informatics, and we are talking only about health, only about medicine. It's medical, clinical, biomedical, nursing, imaging, public health informatics, and plentiful of it. Remember, this is your mind, this is a human being, along with data, has to have some greater significance, some greater meaning than the individual mind thereby. So we need to understand the method in the madness, and that is where the data will come around it. That is where the fundamental theorem of informatics is all about it. An area of human endeavor that can be supported by information technologies such as entertainment, law enforcement, healthcare, other fields in which computer technology obviously interacts with people. The Center of Disease Control and Prevention. Public health information is defined as the systematic application of information, computer science and technology to public health, practice, research and learning. Modified health informatics, the system applications of the information system, and the computer science of technologies to health practice, research and learning thereby. Why are we looking at health informatics? Health informatics should be applied to healthcare and population health, which includes management and use of data with respect to healthcare, involves information technology, and obviously it has to have a standard. Look what has been done. I'm giving you approximately 7 to 8 years back data, 2007 2016. Now, which was populated about the broadband penetration, and you look at it, 90.3 way back in 2016. That's up something around 6 7 years back, right? Approximately 90% of the developed countries will actually have a huge penetration, whereas LMIC, low and middle income countries, will have less than 20%. The middle income countries were doing just about it. I'm sure developing countries have caught up, the developed countries. I'm sure the rest of the world, the low and middle income countries are also catching up by leaps and bounds faster than you think. So what are we talking about the current trends? We are talking about the mobile health. We are talking about the electronic health. We're talking about electronic client level system, health administrating information system, as in logistic, HR, aggregated level information, health information exchanges, and interoperability. Look what we are looking into it. We are talking about the patient, the person in focus, the mobile application for the knowledge, adherence, self-testing diagnostic, as in DIY kit, do-it-yourself kit, SMS short messaging services, patient portal and record. Then comes the healthcare professional. What are the healthcare professionals? They are doing about point of care diagnosis, telehealth consultation, e-learning tools, connected with health platforms, networking and connectivity with peers, and decision support as on when on basis. Then comes the healthcare organizations and policymaker. We're talking about the inventory, stock monitoring, shared EHRs and real-time data, patient data management and analysis, streamlining of financial transaction, predictive analytics and risk stratification. We talk about disease surveillances, predicted outbreaks, and mitigating frauds and abuses. Now let us talk about World Health definitions. As far as e-health is concerned, it is all about use of information and communication technology, ICT, for health for different purposes. Remember, healthcare information management system, the society defines the application of internet and other technologies to healthcare for various goals and objectives. Digital health and e-health, umbrella terms to encompasses all concepts and activities of intersection of health and information. Communication technologies, including mobile health, health information technologies, electronic health, and telehealth, encompassing three main functions. What are they? Delivery of information system to the health problems, health professionals, and health consumers through net, internet, and telecommunication. Second, use of information communication technology to improve public health services, let's say through education, let's say training of the health worker. The third one is to use the health information system to capture, store, manage, and transmit information to the patient health or the health facility thereby. Remember, HIE health information exchanges is all about electronic movement of health related information among organizations, involves network, local, state, health, national health information initiative through the utilization of electronic health record. Health information exchanges support the sharing of health related information to facilitate and coordinate care. Last would be interoperability. In healthcare, interoperability is the ability to use different information technology and software application to address, communicate, exchange data. Remember, during COVID-19, we used to check the oxygen level in your blood through oximeter, and people used to have DIY kits, do-it-yourself kit in at home. They do not need to go to the medical center any longer. Today, people are now checking their own blood pressure electronically at the comfort of their home. What are there? People are checking their blood sugar at the comfort of their home. They don't require a medical professional or medical interventions thereby. So data exchanges, schema, standards should permit data to be shared across clinicians, labs, hospital, pharmacy, patient, regardless of application and application vendor. With this, I come to an end of this video. Thank you for watching it.